And we're going to start with Democratic Congressman Glenn Ivey. Thank you so much for coming in.
Sure.
Let's start with this. We've been here before. We've been through a shutdown before, but this one is different. The last one in 2018, 7 years ago, lasted for 35 long days.
Right.
How is this one different this time around?
Well, one is that President Trump is threatening a punitive attack on government employees. He's already launched one on January 20th, but to penalize, to permanently RIF people, unless the Democrats sort of bend to his demands. I think most of the people in my district are like, well, he's been after us already anyway for the past 9 months, so there's less concern about that threat. The other big piece, though, is the health care piece, as you alluded to. The Republicans cut $1 trillion out of Medicaid, and that's going to have an impact on Americans across the country. People with like elderly care, disabled children and the like. And the other big piece is the Republican refusal to extend the tax subsidies for the Affordable Care Act, Obamacare.
Right.
So we need to make sure that we get both of these things done. We want to reopen the government as quickly as possible for obvious reasons. But the American people need to be let out of this hole that the Republicans dug with respect to health care.
And to your point, this impact is far-reaching.
Yeah.
There's a huge ripple effect, not just to the federal workers, but of course to the businesses that serve the federal workers as well. And it's already happening in a very tense, scary time as it is. So what do you say to your constituents, to the people that are wondering, is there a last-minute deal that could happen here? How long will this take? What are my resources?
Yeah, federal contractors are being hit pretty hard with this too, but there's always a way to reach a deal. I mean, a big step in the right direction would be, to have conversations. The Republicans didn't have any discussions with Democrats on the House side until their bill hit the floor, and then they forced it through on a party line vote. I think they got one Democratic vote out of 212 or so. So hopefully we'll be able to get to a point where we have those discussions. Then after they took that vote, the speaker sent all the Republicans out of town and hasn't brought them back yet. The Democrats came back yesterday to try and work on something. There are no Republicans here to work with. Hopefully on the Senate side, there'll be more of an effort to have bipartisan discussions, but we'll have to see.
Just to build more on the healthcare piece, of all the things that the two sides disagree on, and there are plenty, it does seem like that healthcare piece is the critical divider. Give me a sense of what this could mean to Americans if this doesn't happen.
I mean, the estimates are somewhere in the range of 15 to 20 million people who could lose health care coverage. That's just based on the ACA extension. With respect to the cuts for Medicaid, it's far bigger. And not just people losing coverage, but potentially hospitals shutting down, medical institutions, because Medicaid provides the revenue stream for some institutions, especially in some of the rural and urban areas. Big chunks of the revenue they need to stay open. So if you shut that down, we're going to lose some of those already. I think you've already seen 2 or 3 of them close in Virginia already, and we've got some at risk in Maryland as well.
What specific protections are you advocating for the residents in the DMV?
Well, there's legislation to try and make sure they get their back pay. They're supposed to get their furlough. People who are furloughed are supposed to get back pay. We've got legislation aimed at making sure that everybody gets paid who doesn't get a chance to go in and isn't deemed essential. And also, I think we've got to make sure that there's protections for people who are trying to figure out just how to muddle through this from a financial standpoint. So there's some efforts by the state. The governor's announced a rollout and the county executive too, working with financial institutions, perhaps extension on loans or refinancing capability. Maryland, I think, has a $700 interest-free loan that's available to some people who've been forced out of their work for a particular time period. So there's efforts like that going on, but it doesn't fill the whole gap.
Yeah. I want to also get in the resources that you're providing to your constituents, the webinar, and other resources that you would like to mention.
Yeah, I know a big piece of this has been information. The Trump administration didn't put out its implementation plan until today, actually. So one of the things we're trying to do is, I've got a webinar live stream coming up at 5 o'clock today. Go to ivey.house.gov or Facebook. You can reach it on my official site as well. But in part to provide information and answer questions. We've got some experts on the call who can help address some of the concerns.
Fantastic, because I know there are plenty.
Absolutely.
Congressman Ivey, thank you so much.
Thank
Working
you.
hard for the community, as always.
Thanks for having me on.
All right, of course.